Hi everyone, welcome back. My name is Hina Mazarudin and I am your Vice President for PAs in Virtual Medicine and Telemedicine. Today I'd like to continue a series that mirrors and complements our educational webinars that we do for our PA students so that we can share and shed some light on real-life examples of how PAs utilize telemedicine in their respective fields. I'd also like to use this opportunity to highlight our amazing members and to serve as an introduction or a networking opportunity so that we can build and connect together. You know that I believe we are stronger together. So without further ado, let's get started. Hi everyone, welcome back. Thanks so much for joining us. Today I'd like to introduce you to another amazing PA. Her name is Tara. You may have already seen Tara as she and I did a collaboration for a course titled Telehealth Foundations. If you haven't checked that out yet, please go to our website and you'll be able to see that. Tara is a board-certified PA who recently got her doctorate and practices psychiatry and has a focus on addiction medicine, all utilizing telemedicine. Welcome, Tara. How are you?
I'm great. Thanks for having me.
Absolutely. Tara, can you start off by stating your name, how long you've been a PA for, and how you utilize telemedicine, please?
Yeah, sure. So my name is Tara Iacono. I've been a PA for about 15 years, different fields, primary care, geriatrics, but mainly psychiatry and addiction medicine. I have been doing telepsychiatry since January of last year. And I work for a private practice that is contracted with a large group located in the rural region of northern Arizona. Most of the patients that I work with are underserved, and I really enjoy what I do.
Awesome, thank you. And what do you like about telemedicine, and what do you find to be a challenge?
Well, I really love the freedom that telemedicine affords me. I am a wife and a mother, and I can work from home and take care of my home and make dinner in between patients, or if I have a no-show. That's a really big deal for me. Other jobs that I've had, I've out the door at 7 a.m., not home till 6 or 7 p.m., and things aren't done. So this is really a nice work-life balance for me. The other wonderful thing about it is I don't need to find childcare if my 8-year-old son is homesick for some reason. He can just, stay home and watch some TV, and I don't have to worry about finding care for him. The biggest challenge for me as far as telemedicine is concerned is really pretty much just technical. Every once in a blue moon, we have like an internet connectivity issue that can be frustrating, but typically we can work through it. I think in the last year and a half, I've only really had one day where I had to maybe cancel a couple of patients because of internet issues, but that's been the biggest challenge for me so far.
Absolutely. So it sounds like it's giving you a great work life balance with your personal life. And then, as far as the challenge goes, definitely some technology issues, but hopefully that will get better as we keep moving forward and having new advancements, better internet connection, and able to connect with our patients that way. Tell me a little bit about addiction medicine, and is there something you like about it, or something you find it to be a challenge in reference to using telemedicine to connect with your patients for that?
Well, certainly with addiction medicine, one of the challenges is getting urine drug screenings from patients. I think in a setting other than the setting that I'm in, I think it's challenging for patients that are being seen from home. I have my patients are being seen in clinic, so I have a full staff, medical assistants and nurses that are on site collecting vitals and also getting urine drug screening. But outside of that setting, that would certainly be very challenging in addiction medicine.
So it sounds like it's almost a hybrid model where they are definitely the patient at least is able to come into the clinic and get services that they would as they normally would in a regular clinic, but they're more of utilizing you as a provider to maybe oversee multiple or just having you kind of come in and seeing via telemedicine as many as you can, I suppose. So that way it gives you better access to your patients and your patients get better access to you.
Yes, absolutely. Hybrid model is a great word for it. The clinic itself has primary care providers, mostly PAs on site, and then also a couple of other nurse practitioners, psychiatry nurse practitioners on site. And then myself and a few other PAs work via telemedicine. And I never go on site. Maybe one day I'll go visit, but at the moment it's all via telemedicine.
That sounds absolutely amazing. Could you share a message or a clinical pearl or words of wisdom or something with our fellow PA students, along with our fellow PAs, please?
Yeah, sure. I think if you're interested in doing telemedicine, don't be afraid to just keep trying and maybe get creative and maybe work with your current employer to implement a new telemedicine program in your existing practice. And if that's not a feasible option, definitely just keep applying for positions if it's something that you want to do.
All right, thank you so much, Tara, for joining us, and thanks everyone for tuning in and watching. We'll connect with you soon next time. Take care. Bye, everyone.